I had suffered with chronic sinusitis for many years, and I just would treat it with antibiotics and different things. And finally, my primary care doctor was like, you need to see an ENT because they can really do something that can help you with your chronic sinus infections. So Dr. K did an examination, and he could tell that I had chronic sinusitis because I had lots of mucus, and just some of my symptoms were the sinus infections all the time, which was limiting me in my life. Just really struggling with being able to breathe properly. And so when I came to Dr. K, he told me that there were several options, and we started with allergy injections. And then I wasn't seeing a whole lot of improvement in the beginning with those. And so he did a CT scan, and that's when he found that I had very narrow passageways in my sinuses. And he suggested and recommended that I have the sinuplasty balloon procedure in the office. I had the procedure at the beginning of 2020, since then, I just continue to see improvement. I'm still on my allergy injections, and I have seen even more improvement in doing both, which is what Dr. K recommended for me, to do the procedure and also have the injections on top of it has just really improved my sinuses. I have less headaches. I haven't had one single sinus infection since I had the procedure done in the office.
It's much less likely for you to develop sinus infections because there's a lot less chance of having a significant amount of negative pressure in that area, and the passageways are more open, so air can go in and mucus can come out. That natural function of your sinuses can be much better off than you were before. So just much like angioplasty of the heart arteries, we took a clogged opening and enlarged it. Now that opening is good enough for most patients, okay? Sometimes if you continue to have persistent problems, those openings aren't enough for you, in which case you need to consider surgical options. Mm-hmm. But the vast majority of patients don't have to go into surgery if they stay on the train and continue to work on controlling the swelling and inflammation. They can take advantage of the openings that we made with the balloon so that we can have free flow of air and mucus in and out of your sinuses.
Okay. If you're someone that's considering this treatment, you've talked to Dr. K or his staff, and you're trying to decide if you want to have the procedure, I say go for it. If you've struggled with sinus infections over and over and over again, this procedure can really help you. It has improved my quality of life, and it's just something that I think anyone that is suffering with this type of issue should really, truly consider going forward with. Hi, I'm Tina Ridge. I'm a patient of Dr. K's.